Good morning, guys. Welcome to Afya Leo. Thank you so much for choosing GTV as your online TV station. So my name is Caroline Bidhe. So today we are answering a very sensitive and crucial topic, that is HIV and AIDS, mother-to-child transmission. And we are privileged to have a clinical officer today with us. So I'll just allow you to introduce yourself to our viewers.
Thank you very much. Good morning, viewers. My name is Rhoda Churi.
Yes.
I am a nurse by profession. I campaign for mothers and children in HIV. I coordinate HIV services and PMTCT services in dispensary of Kango, Kirinyaga South, Kirinyaga County. Welcome, viewers. Welcome to GTV. Thank you.
Thank you so much. So before we go to mother-to-child transmission, just help us understand more about this virus that causes HIV and AIDS.
Okay, thank you.
Yes.
HIV and AIDS is a virus. It is an immunosuppression virus, or it is an immunodeficiency virus. That virus acts by attacking the body cells. Every person has body cells that fight diseases or infections. In other words, cells that boost the immunity of the body. So this HIV virus targets those cells, and it targets to kill the cells. And then after it kills the cells, it replicates, it multiplies in the body, and it dominates the cells or the immune system. And therefore, the person who has the virus starts suffering several infections, especially opportunistic infections like TB, like bacterial infections, like meningitis, diarrheal diseases. So what the HIV virus does, actually, it is suppressing the body through killing the immune cells. That is the work of HIV virus. Yeah.
Okay, and is HIV and AIDS the same thing?
Okay, HIV is the virus, and then when it enters the body system, and it does destruction to the cells, the immune system of the person that has the virus goes down, and therefore that body is susceptible to many diseases. And therefore, after the immune system has gone down, or rather the immunity has been suppressed, that is when several diseases will enter the body system. And therefore, after this person is attacked by many diseases or infections, now the classification or the several diseases that come into the body make the term to change from HIV now to AIDS. So AIDS is the final stage of HIV action in the body.
Okay.
Yeah.
And how comes that a person, that is a couple, one person is HIV positive and the other person is not HIV positive?
Okay, yeah, in some instances you will test a couple and one turns positive and the other one turns negative. We call it a discordant couple, where one person has tested positive and the other one has tested negative. And in this case, we say the HIV virus attacks the T cells of the body, and some of the T cells of the body of some people, they are not sensitive to the virus. So it takes some time for that person to get the virus into the cells, because it has to work with a specific cell. So some body mechanisms, they don't react or they don't sense the virus, and so they remain negative. Or rather, it is a research that is being done. Critically, we cannot say it is because of the cells, but we still know that there are researches which are going on to determine why the person remains negative in such a situation. But at the moment, we are saying it's a discordant couple. Rather, we may be having somebody who is promiscuous in a couple or in a relationship, and they get a virus, and the other remains negative. Why? Because our bodies are not the same. So there is someone who will move or will have sex with someone who has a virus, and they don't contract it immediately, especially if the virus has not replicated so much in the body. So we can have one who is negative and one who is positive. Yeah.
And are there precautions that you give to the person who is not HIV positive?
Yes, the person who is HIV negative or who turns HIV negative, there are precautions, there is management, there is prevention. So we have several factors, we have several things that we do. We have counseling. We do the counseling at the time of testing, even before testing and after testing. Because when we are testing a couple, or rather a person, there are chances that one person may be negative and the other one is positive. So we have to give education, and we have to do pre-test counseling to prepare the people for the results. And also during the testing, there is a time that we give them a time to reflect of the results and about the results. And then after testing, there is a time to counsel on what has happened or what we have seen from the results. And so there is thorough preparation, and there is management after negativity, there is management after positivity.
Okay.
Yes.
Now let's go to mother-to-child transmission. What are those precautions that you give to a pregnant mother who is positive?
Okay, in a case where we find a pregnant mother who is positive, first of all, let me say, a mother is a mother like any other. We don't like calling them HIV positive mothers. We call them our clients. And so there is a client who will come for ANC services, normal ANC services. The first precaution we take in a mother who is coming for ANC or antenatal services, during the first visit, the first thing that we do is testing for HIV, counseling and testing for HIV, because we are expecting a newborn, and we want the newborn to have good health. We also want to work with this mother antenatally when she is healthy. So among the things that we do during the first visit of an antenatal mother is testing for HIV. And now in cases like you are asking, where a mother tests positive for HIV, one thing we do, first of all, we counsel the mother about the results and about the virus. Of course, you know, the virus will never move out of the body, even when we do treatment. So we help her to know she will live with the virus. And in this case, when she is pregnant, we help her to know, or even to know how to work with the pregnancy, with the virus, with the unborn baby, with the factors that carry or move with the pregnancy. And this time now she has turned positive. There are several interventions that we do. I've said one of them is counseling, because counseling opens the way to every other management. Then after she turns positive, we still have some drugs. In this last, previously we used to give people time to decide whether they want to take drugs or not. But right now, even the guidelines has said that once you test someone, you have to start the treatment, that is ARVs. And therefore, for this mother who has tested positive for HIV, during the first visit antenatally, we prepare her for treatment, or rather for ARVs. And therefore, the first day, she receives her ARVs. And then there is something else we need to do. We also need to counsel her about the child whom she is carrying. Because at the moment when she's pregnant, there are very high chances of transmitting the disease or the virus to the child that she's carrying. So we prepare her well, and then we dispense some ARVs for her immediately. And we prepare her for life and for management for life. Yeah.
And how is the virus transmitted to the child when the mother is pregnant?
Okay, thank you. When the mother is pregnant, she remember her body immunity is already low because of the pregnancy. And also remember we said that the virus targets the body cells so that it lowers the immunity. And therefore this virus has already come to a already low immune body, and therefore it will bring suppression of the immunity. And this is risky for the baby because pregnant mothers, they have some low immunity, and therefore the virus has come, now the immunity has been suppressed. So we say they are at risk. And the baby that she's carrying is exposed actually, is not sick and may not be sick. but the body, we say the baby is exposed. And so during the time of pregnancy, if the mother's HIV positive was not detected early enough, then the child can contract right in utero. Or rather, if the mother had very high virus replication in the body, there is something we call viral load. Viral load is the amount of virus in the body. If the amount of virus was very high during pregnancy, then the child is very much exposed and very much at risk. And therefore, at that time in utero, the child can contract HIV from the mother. Yeah.
Now, how is it?
Okay, you know, when the baby is being formed in the uterus, the system of the mother is used to generate the system of the child, and also the blood of the mother, and everything actually the child feeds from the mother directly, because through the amniotic fluid, the supplies of the body come directly from the mother. So if the virus is too high or too much in the body, there is also a chance that it shall be transmitted. Yeah.
Okay, and are those the same steps that you take to a person who, a client, you have called them clients, a client who you knew earlier, even before the pregnancy, that she is HIV positive? Is it the same process that you take?
Okay, it is almost the same process, but for a mother who was already known positive before pregnancy, she has a lower chance of transmitting. The reason is because she has already been managed. And one thing that happens when you introduce ARVs to the body system, the body cells are rebuilt again. They multiply, they reproduce. And then the HIV virus is made dormant. And therefore, the virus will not replicate or it will not multiply. And therefore, this woman who has been on ARVs, her body cells has been boosted, or rather they have multiplied enough, and then the HIV has been suppressed. And therefore, when we check from a test that we call viral load tests, we realize that now the viral load has gone very low. It cannot even be detectable. It cannot be detected. And therefore, when the viral load or the virus cannot be detected, we say that woman or that mother has a undetectable viral load or low LDL. That is how the result is written. And therefore, with this mother who has low viral load, the chances of spreading the disease is very low. Yeah. So now this mother who has been working with the ARVs and now she has become pregnant, she has very low chances of transmitting to the child.
Okay.
Yeah.
And what is that you do to a mother who is now mwenye amekaribia sasa siku zake za kudeliver? What is that thing that you do that people find out that the child is HIV negative but the mother is HIV positive?
Okay, I said once the mother is pregnant and is HIV positive, we have some interventions. The first intervention is counseling. Then the second intervention is introducing ARVs and giving to the mother, and she starts immediately. Then the third intervention is introducing the prophylactic treatment. Prophylactic treatment to the baby means the drugs that we shall give to the baby when it's born. Immediately the baby is born, there is some prophylaxis that we issue to the mother, so that immediately after delivery, she gives to the baby. Now, this prophylactic treatment is meant to prevent the child now from contracting HIV during breastfeeding. Now we have moved from the step of antenatal, and now we have come to delivery. Let me say we have come to labor and delivery. Now, during labor, remember this mother is still on ARVs, so we are still preventing the child. Then after delivery, now there is disconnection between the baby and the mother. And now we have a baby who is exposed. Exposure is saying that child who has been carried by a pregnant mother who is positive. And therefore this child, we introduce prophylactic treatment, that is preventive services. We give some drugs which the child will take until at least we get that child negative. There are some steps we take to know whether the child is positive or is negative.
Okay, hold on there. We are going for a short break. We'll be right back.
Thank you.